Okay, hello everybody. We're just going to wait a few minutes and I'll get everything geared up, see if there are some last minute people wanting to join. There should be somewhere where you can type in any questions that you might have throughout the presentation, and we will hopefully be able to address those at the end for you.
Good afternoon, everyone. This is Jackie Reid here from New Mexico. Welcome to this webinar, the second in our series, and thank you all for joining us this afternoon. It gives me great pleasure to introduce you to our presenter today, Dr. Corey Noble, Research Director at New Mexico. Corey.
All right, so thank you everybody for attending. Hopefully you're not having any technical difficulties. And as I said before, any questions that you have, please feel free to type them into the Q&A box and hopefully we'll be able to address those at the end. I should say there will be a recording of this made available as well at a later date, should you miss anything or want to go back and listen to it all again. So I'm going to talk today about measuring health-related quality of life from the cat's perspective. So New Mexico has worked to develop and we've gone through a validation process of a generic health-related quality of life instrument for cats. Today I'm going to talk a bit about the background as well as the psychometric development process that we go through to develop this instrument, how we've tested the validity, as well as talking about how the instrument performs in cats with osteoarthritis, and wrap things up with what we're doing next. So I should start by saying Jackie presented our first webinar on measuring chronic pain in dogs a couple of weeks back now, and there's extensive background of pain and pain measurement in humans and animals. So if you would like to do that, I direct you to go to our website and look at that webinar, which will go a lot more in depth than I will today. So for those of you that don't know, health-related quality of life is a multidimensional concept that's well recognized in humans and more recently in animals and veterinary science. And what health-related quality of life is it's not only looking at and measuring the health status of an animal, but really trying to measure how the animal feels about its circumstances. So it's capturing a uniquely personal and subjective experience, which, as you can imagine, is a bit easier in humans who can self-report, but a bit more difficult in animals as well as nonverbal humans. So what we've tried to do at New Mexico is develop instruments that not only quantify health-related quality of life as one aspect, but really looking at the whole spectrum, trying to measure quality of life that could not be better and quality of life that could not be worse. So just to give you a bit of an idea of what our instrument looks like, this is a snapshot of a case example from our Vetmetrica health-related quality of life instrument for dogs. And it's just to show how the instrument sort of works and why we think it's pretty exciting. So the dog instrument has 4 different domains of health-related quality of life, which is what we're looking at here. And really, this dog was an 8-year-old dog who suffered from chronic back pain and was on long-term pain management for spondylitis. And the owner decided to try laser treatment. Hopefully you can all see my mouse here. And this is where we start the laser treatments, 6 rounds, and this is where we end the laser treatment. And each dot here is the owner completing a questionnaire. We thought this was quite interesting, this big dip here, and went back to ask the vet what was going on during this time period. And this is when the owner had decided to give her other dog 6 rounds of laser treatment. When she found that he didn't really respond as well to it, she then decided to give the rest back to dog. And actually, this is what we see with an increase in his happy and content and the other domains of quality of life. So really what we're trying to do is we can actually track clinical improvement and the efficacy of treatment, and on the flip side we can track the progression of disease as well. So this is what we've created for the cat. So how we develop this and the psychometric approach is really the gold standard for instrument development. We're not just picking questions out of a hat. We're not making them up. We go through a very rigorous process that helps us ensure that we've done it correctly. So we start by conducting semi-structured interviews with cat owners as well as veterinary experts. This included specialists in feline medicine, as well as GPs, general practitioners, and specialists in osteoarthritis, neurology, cardiology, etc. So some examples of questions that we ask owners are here on your right. So we're asking them to describe their cat's daily routine, if they think they can tell how their cat is feeling, if their cat is unwell, how did they first know, what were some of the behavioral changes that they noticed, what behaviors they notice to indicate to them if the disease is getting worse or better, how do you know treatment is working, etc. So we asked 18 cat owners and about 10 veterinary professionals, and all of these interviews are recorded, transcribed, and then we're going to pull out different descriptors or items or behaviors that might be useful in our instrument. I should also note that we did interview owners of perfectly healthy cats as well as owners of sick cats that were suffering from osteoarthritis, hyperthyroidism, as well as chronic kidney disease. These owners were from the United States as well as from the United Kingdom, so we're collecting words from both places as well, or items. These will basically be the items that go into our questionnaire. So I just wanted to report this because I find it quite interesting. This is a list of owner-reported behavioral changes that were associated with chronic and painful orthopedic conditions in dogs. So we've got here a list of behaviors that over 50% of dog owners reported, as well as behaviors that over 30% of dog owners reported. Now, if we take away items that were not reported for the cat, what we actually find is those that were reported by less than 25% of dog owners were actually reported as being extremely important by almost 100% of cat owners. So this just highlights that it is important to go through this process for every single species as well. So after this whole process, what we were left with is 165 descriptors or behaviors that we're then going to take forward to our phase 2 of item generation. And this is going to help us decide what our questions are going to be. So 165 questionnaire is not very feasible. So we need to go through a process of narrowing down our items. So the research team meets and we go through iterations of these items, and on the left column here, you're looking at some basically justifications or reasons why some items may have been removed. So we're looking at maybe they're explicitly describing underlying personality traits. So this might not necessarily be useful or to indicate changes in health status. They might be too specific to one disease. We're trying to make a generic instrument. They might be too clinical, so again, not something that the owner is going to recognize easily, or specific to one individual cat, maybe not relevant to health-related quality of life, or more often, there's synonyms. So maybe there's a more appropriate descriptor or phrase that is better to use. So friendly was more commonly reported than sociable or follows me around or coming to greet you, for example. So that really sort of captures the next few. And then quite a few items are revised to improve clarity. So just making sure that they'll be understandable to every owner who might be taking this questionnaire. And once we have our final list, we're going to, which I think we had 51 items after that process of elimination. And these 51 items are then presented in online content validity surveys that we had 47 owners complete and 10 vets complete. And here we're asking for each item that the owner or the vet rates how relevant these are to feline health-related quality of life, and also letting us know if the items are clear, so telling us if they're clear or not clear. And finally, we ask them if they feel the items adequately cover feline health-related quality of life, and are we missing anything? So following these content validity surveys, we analyzed the data and we were left with a generic instrument that was 39 items. So this is our prototype, which we're now going to field test so that we can then devise a scoring algorithm. So this first field test, we've put the instrument now online, and we've asked 71 owners to complete a single assessment. Of these cats, 30 were perfectly healthy and 41 were sick cats. Now, I should also mention that when we're classifying a cat as healthy or sick, this is done by the clinician's assessment. So we're not asking owners to tell us if their cat is healthy or sick. We're only including cats where we have had a vet consult and the vet is telling us that the cat is sick or healthy. So of this data, we've had some interesting results. We cover an adequate age range as well as breeds. And what's interesting is 95% of the sick cats that were assessed had comorbidities or suffered from more than one condition, actually 1 to 7 additional conditions. And also, when owners were asked to classify their cat's health, 29% of owners of unhealthy cats actually misclassified their cats as being healthy, so they felt their cat was perfectly healthy, in contrast to the clinical assessment. And as you can imagine, this is I find this quite astounding, and I think it's important to note that owners, can often misidentify whether their cat or animal is healthy or not. So following this field test, we then look at the data and we go through factor analysis. And this is really what's going to get us our scoring algorithm and help to assign our items or our questions to health-related quality of life domains. So like the dog had 4 health-related quality of life domains in our dog instrument, the cat has 3. So this is so we're looking at vitality, comfort, and emotional well-being. So this is how the items group, and based on the items in each of these domains, we get a theme. So it really made sense. It was easy to name them, which was great. And this gives us our generic health-related quality of life profile. And this is a 20-item instrument that we're then going to take on to a second field test to determine validity. So in this second field test, we had 115 single owner assessments. I should also point out that these are new owners, so new cats, 43 healthy cats and 72 sick cats. We had 54 repeat assessments, and in this group, 75% of the cats assessed had comorbidities. Again, these are reported by the vets, and 26% of owners of unhealthy cats misclassified their cats as healthy, in contrast to the clinical assessment. So again, we're looking at a fairly substantial amount. Over here on the right, I've got just a list of conditions that were reported by the vet, as well as the disease severity. So the most common being degenerative joint disease or osteoarthritis, a chronic medical condition, or the cat being underweight. So when we're looking to test validity, we're testing 3 different types of validity. So content validity was established during the construction of the instrument. So these were the content validity surveys, making sure that we're measuring what we say we're going to measure, and that the instrument questions make sense and they're clear. And criterion validity is the second test of validity, and this is where you're comparing the scale to some gold standard. Well, we're currently unable to do this because no gold standard currently exists. So we're next going to look at construct validity. And how we do this is using factorial validity. So in the generation of the scoring algorithm, we look at the percent variance of our factor model. So in the generic instrument, we've got a 3-factor model that accounts for 72% of the variance. So we're quite happy that this demonstrates factorial validity and compares well with other health-related quality of life instruments for infants and dogs. Next, we're going to look at discriminant or known groups validity. So this is where predictions made about how scores should differ between groups. So for example, here we've looked at healthy and unhealthy cats. So the interval plot here shows the mean scores of both of these groups, as well as the 95% confidence intervals. And we can pretty clearly see that there's a significant difference in scores, as well as, I should say, there is a statistical difference between these groups for each of the 3 domains. So as predicted, healthy cats will score better and sick cats will score worse in each of these domains. Next, we've looked at, we found it very interesting that so many of these cats had comorbidities, so we wanted to look at how these scores relate to comorbidities. So here in this graph, we've got our health-related quality of life scores. So 6 being the highest you can get, good quality of life score. And we've got the number of comorbidities. So as you would imagine, the more conditions that you are presenting with, the lower your health-related quality of life score is. And we see that in all 3 domains. Emotional well-being, still a significant correlation, but again, this might be a more subjective domain, so we do expect it to maybe not have as significant as a relationship. So next, we're also going to look at linear discriminant statistical analysis. So the instrument, when you run it through linear discriminant analysis, correctly classifies 84% of cats as either healthy or unhealthy. And again, we're quite happy with this because this compares well with our health-related quality of life instrument for dogs and an observer-completed instrument for pain in communicatively impaired children. So happy with these results as well. Next, we're going to look at reliability. So those owners that completed a first and second questionnaire for our control cats, so these are our healthy cats, cat owners, excuse me, who have completed a first and second assessment 2 weeks apart. So you wouldn't expect health status to change in that 2 weeks. And similarly, you would expect the scores not to change. And that is what we find. We find it shows good test-retest reliability. And when we look at our inter-class correlation coefficients for all 3 domains, they are well within the range that we would expect for good inter-class correlations, being anything from above 0.6. So we're quite happy that the instrument is reliable and performing well. And responsiveness. So this is ongoing. As the more data that we get, the more we can sort of look at exactly how the instrument performs relative to clinical change. So for example, in the example that I presented about dog, he's responding to laser treatments. So we're still collecting data for that, but we did want to look at how the scores change with the owner's impression of change. So again, we're looking at the sick cats, cat owners that have completed first and second assessment, excuse me. And really what we're looking at here is the difference in scores, so the difference from the first assessment to the second assessment, and whether these scores have improved. Apologies, I forgot the legend here, but whether they have improved, whether they were unchanged, or whether they were worse in each domain. And again, what we can see is a general trend here that you would expect. So unchanged is roughly about 0, so no difference in the scores, where if they've improved, you've got a positive difference in the scores, and if they were worse, you've got a negative difference in the scores. I should highlight that we've only got 1 cat here, so again, this is very preliminary data, but hopefully as we begin to collect more, we can look at the responsiveness of the instrument in a lot more depth. So now we're going to look at Vetmetrica for cats and osteoarthritis. Osteoarthritis, as I said, was the most common condition that was reported. So it is the most prevalent, and in interviewing vets at the very beginning of this study, they did feel that osteoarthritis was the most common chronic condition that had the most impact on feline quality of life. There's also a lack of recognition. So many vets will say that it's missed by owners as well as themselves. It's hard to recognize. Even radiographic evidence of joint osteoarthritis in joints does not necessarily correlate to behavioral changes. So that's important. And currently there is not a fully validated owner-based questionnaire for recognizing chronic pain in the cat. And there's really even more of a lack of instruments to measure health-related quality of life in cats, especially cats with osteoarthritis. So there's really a need for validated outcome measures, especially in clinical trials, so that we can try and look at different options for treatments of osteoarthritis in cats. So additional clinical, so how we looked at this, excuse me, one second, yeah. So how we looked at this is we pulled the data from our 115 assessments, and in addition, we asked vets 19 additional clinical questions. So we asked them to observe the cat in a consultation and to make note of clinical observations that they might expect to see in a cat with osteoarthritis as being present or absent. So for example, we asked them to report on muscle wastage. Are the claws overgrown? Is the cat bow-legged, or are there other postural abnormalities, etc. So they're going to say, is this present? Is this absent? We also gave them an option to say not applicable, because if a cat is in pain, we're not going to have a vet forcibly look at the claws, etc. So we were able to get this assessment from 41 cats, of which 11 of them were healthy and 30 of them had osteoarthritis. When we look at the data as a whole, the breakdown is we had 43 healthy cats. Now again, we didn't have a clinical assessment for all of these, but it helps us look at the data. We've got 43 cats in total with osteoarthritis, and we've got 29 that are suffering from some other form of condition. Interestingly as well, we've got a high number of comorbidities, where cats with osteoarthritis have up to 80% of comorbidities, so that's 1 to 6 additional conditions, and cats with another condition have 41%. So significant differences were found between health-related quality of life domains in these groups. So we looked at the difference between healthy cats and cats with osteoarthritis, healthy cats and cats with mild osteoarthritis, healthy cats and cats with moderate to severe arthritis, as well as there was a significant difference between cats with mild osteoarthritis and moderate to severe arthritis. So we're able to detect a difference even within the substages with the generic instrument. We were also able to detect a difference between other conditions and cats with osteoarthritis and other conditions and healthy cats. So this is all quite positive. When we look at this in sort of graphical form, I've got some interval plots here for each of the 3 domains of quality of life. So we've got vitality, comfort, and emotional well-being, as well as our clinical score. So this is those 41 cats that I said we had a clinical score for. So when we asked the clinician to say whether something was present or absent, the higher score that you had, the better quality of life, so you didn't have as many of these present. And basically what we can see is what we would have expected. Healthy cats have the highest quality of life, and the more severe osteoarthritis you have, the lower your scores are, and that is for each domain as well as the clinical score. And cats with other conditions don't score as low as cats with moderate to severe osteoarthritis. So another thing that we wanted to look at is the relationship between these domain scores, and the clinical assessment score. So again, the higher score that you have on the clinical assessment, the higher you would expect the quality of life score to be, and that is what we see. And the Pearson coefficient scores were all well within an acceptable range. Again, not as strong for emotional well-being, but as I mentioned before, that's not as surprising because this is the area that might be more subjective. So I should highlight that, of course, the limitations of this study include that all of the sick cats that are on some sort of treatment for underlying conditions. And despite these limitations, our Vetmetrica health-related quality of life instrument for cats demonstrates statistical difference not only between 3 groups, but also between severity or substages for osteoarthritis progression. And again, as expected, as reported by vets, osteoarthritis has a higher impact on feline health-related quality of life than any other chronic condition. So what's next for Numetrica? One of the things that we're quite interested about with the prevalence and the severity, the high impact of osteoarthritis on quality of life, we really wanted to see if maybe a disease-specific component could increase the sensitivity of this generic instrument for cats with osteoarthritis. So we have been working on developing an osteoarthritis module, and we're currently testing this. As you can imagine, getting clean cases of osteoarthritis is difficult, but we're persevering, and this includes additional questions for the owner that are combined in a novel way into 3 domains using a unique scoring algorithm. So watch this space. And again, why this is important is because these instruments just don't exist yet. The ones that do are classed as clinical metrology instruments. So these are really focusing on the physical and the functional components. So how the disease is affecting the cat physically and impacting its functional ability. Whereas what we're trying to also capture, in addition to the physical and functional, is really the affective component of the pain experience, and this is what we would call the emotional well-being component, and I think we do that quite well. So hopefully with an osteoarthritis module, we'll be able to increase the sensitivity of our instrument. So in conclusion, I think that I have presented that we've successfully developed a generic health-related quality of life instrument for cats. Our initial results suggest evidence that the instrument is valid and reliable and responsive to change. Again, that testing is ongoing, and we're very excited to see how it performs. And the instrument is appropriate for use in cats with osteoarthritis and certainly those with other chronic diseases as well. As I mentioned, an additional osteoarthritis module is currently in development, so if anybody out there is interested in helping to recruit cats, please do not hesitate to get in touch because we're always looking for enthusiastic participants. So just to sort of take us back to the broader picture, how is this instrument important in veterinary practice? Now, it measures the impact of any chronic disease that affects quality of life, and this is important. And we've developed the tool so that you have access to the data in real time, 24/7, and really it can be used as a routine general wellness measure, and ideally even from the first visit well into the cat's life. We have in our dog instrument a built-in alert system, which we're currently working on crunching the numbers so that we can do this, so that when an animal score, falls out of a certain predetermined range, the owner would then get an alert that they might want to seek veterinary advice. So this is ongoing, but this will be built into the system. And really, it's raising the profile of preventative medicine within wellness models. So, not just coming to the vet when a cat is, visibly sick, but keeping track of its health and well-being throughout its life. Additionally, this helps identify humane endpoints for individuals. So it's really, a visual representation of decreasing health-related quality of life. And even in our field testing, we have had this be useful for cat owners who maybe, who did eventually put their cat to sleep. So it does highlight that, this is an important use as well. It starts that conversation. It gives owners confidence in the cat's health status in between routine visits. And it streamlines the consultation process, really enhancing communication. So owners have something to look at between these visits and, maybe ask for more detail about. It's a novel monitoring of treatment. So really vets can set intervals. They can see how any treatments that they prescribe change the scores. So again, very useful. And longitudinally, as I mentioned, the scores help determine improvement with treatment or decline with disease progression. So now what about outcome measures in veterinary clinical trials? Owner-reported outcomes are often the only option that we've got. And currently the only outcome measures, as I mentioned, available for cats are clinical metrology instruments. So what we're presenting here is a much more thorough outcome measure covering the whole multidimensional spectrum of health-related quality of life. And as I said, there's no validated instrument that measures how the animal feels about its circumstances. And additionally, Vetmetrica incorporates in its design ways to reduce owner-respondent bias. So this includes potential reductions in the placebo effect or false positives, which are often a problem with other outcome measures, including the client-specific outcome measure. And if you want some more information about this, Jackie presented this very thoroughly in our first webinar on measuring chronic pain in dogs. So visit our website and you can get caught up on that. So that is it. So I want to thank you all for your attention. Thank you for your attendance, or thank you for watching later. And thank you to all the practices helped throughout the development of this instrument and field testing, and to Scottish Enterprise and Boehringer for helping to fund the research. So please don't hesitate to visit our website if you have any more, if you'd like any more information. There's a contact page, you can get in touch. Or additionally, feel free to email myself. So I will just check that I can look at now the questions and answers. So I see that we've got no questions that were submitted during the webinar. So if that is all, I will just end this, and don't worry, you'll get a recording. So if you have any questions later, you're welcome to submit them or email me or get in touch on the website, and we look forward to hearing from you. Thank you very much and have a great day.